everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. It's been about a year since the cyber attack on Change Healthcare that brought a $22 million payout to the hackers, and attacks on the industry aren't slowing down. Last year, more than 700 large breaches, that's breaches that include more than 500 records, were reported in healthcare alone. What's even more troubling is the number of records affected are in the 100 millions. That's more than half of the American population. And according to my guest today, patient records only scratch the surface of the threats we face as patients. Recently, I spoke with Joshua Corman, founder of IamTheCavalry.org, a grassroots organization dedicated to safeguarding technology. Here's what he had to say.
The good news is Congress got really angry at the blind spot, and they held HHS secretary accountable personally, wrote some letters, had some hearings to really add to the policy mix that we have to identify entities like Change Healthcare where market consolidation has kind of driven unsound risk concentration.
I think we're all kind of used to getting these letters a couple times a year that some entity has been breached and our information has been compromised. You generally get 6 months or a year or two of credit monitoring, but that's not enough. You tell me that's not enough. What else do we need to be thinking about besides protecting our data?
They're not harmless, but they're tolerable. But while we've been over-focused on that, we've neglected three other critically important things. One is called maintain access to your medical records. So that's, can your caregivers read and act upon your chemotherapy cocktail or your medical history when you need to? Number two, when that gets shut off, we have harm to what's called provide medical care, timely access to care where and when your family needs it. And number three, if that disruption happens long enough, the disruption to your cash flow can close the hospital permanently, and then your community is without timely access to care for good. The only thing worse than being down for a few weeks or a month is being down forever.
Joshua Corman, thank you so much for joining me today.
Thank you.
Thanks for joining us this week. I'm Erica Grotto with Hi-Fi Health News.